Our hormones change throughout the course of our lives. Women experience fluctuations due to their menstrual cycle, and then again when they begin their menopausal transition, also called perimenopause. When you start to experience the symptoms of menopause, what's going on in your body? What are your hormones doing? Let's explore. So, what is menopause? Menopause is a stage that a woman hits when her menstrual cycle stops and she can no longer conceive. There's a negative stereotype that a woman's life is over once she begins her menopausal transition. But in reality, some menopausal women find this stage of their lives to be incredibly free. Now, what's the average age when menopause occurs? Important note, there are no rules for when menopause starts. However, there is a general consensus. It's most common for women to begin their menopausal transition between 45 and 55 years of age, and it can take years to fully transition into menopause. Most women reach that stage by the age of 52. How can you tell that you're officially in menopause? If you haven't had your menstrual cycle, including any spotting for a full year, that's menopause. If menopause hits you earlier, you're not alone. Some women experience premature menopause, which happens before the age of 40. Early menopause occurs between 40 and 45 years of age. Again, use your menstrual cycle as an indication in addition to any other menopausal symptoms that you're going through. So, why do some women experience premature menopause or early menopause? Certain factors can put you at an increased risk of premature or early menopause, including any surgery that removes your ovaries or uterus, a family history of early or premature menopause, chemotherapy or radiation, smoking, and starting your menstrual periods before the age of 11. Certain diseases or conditions can also be risk factors. These include genetic conditions like Turner syndrome, autoimmune disease such as rheumatoid arthritis, and even infections such as HIV, AIDS, and mumps. So, what hormonal changes are involved? Menopause comes with fairly significant hormonal changes, which helps explain the common symptoms of menopause. More on those in just a minute. Of note, during menopause, the ovaries stop releasing eggs, which is why menstrual periods stop and you can no longer conceive. This also means that the body produces less of the hormones estrogen and progesterone, and that's what can trigger menopausal symptoms. Now, what are common menopausal symptoms? Menopausal symptoms look different for everyone. Some women don't experience them at all, or they might experience mild symptoms. Other individuals might experience common symptoms such as hot flashes, mood changes like irritability, brain fog, night sweats, urinary tract infections or UTIs, urinary incontinence, hair growth, fatigue, weight gain, vaginal dryness, and pain during sexual intercourse. If you're experiencing these symptoms of menopause, speak with your healthcare provider about your options. Certain medications and even simple lifestyle changes can help. Now, how to address menopause symptoms. Menopause isn't the end, and you certainly don't have to live with the symptoms. Both hormone therapy and adjustments to your lifestyle may be able to quiet some of the physical and emotional symptoms that you're experiencing. So, what's the role of hormone therapy? The sudden drop in estrogen and progesterone leaves some women feeling pretty lousy. Hormone replacement therapy is one way to counter this. Boosting estrogen levels can help offset bothersome symptoms of menopause like hot flashes, vaginal dryness, and mood swings. Do note, though, that hormone therapy comes with its own risks and side effects, including an increased risk of breast cancer, blood clots, and heart disease. Furthermore, hormone therapy is only appropriate at certain stages of menopause and for specific reasons. Speak with your provider about the benefits and health risks of hormone therapy and if it's the right path to address your decreased estrogen levels. Now, on to lifestyle changes. Whether or not you decide to pursue hormone therapy, consistently making smart choices every day can also help combat some of those disruptive symptoms. Try to get at least a little physical activity into your daily schedule. Maintain a healthy weight, limit alcohol, and avoid smoking. Spend a little time in the sunshine. This helps your body produce vitamin D and offers countless other benefits. Eat a colorful, nutrient dense diet, prioritizing minimally processed foods, and manage stress in safe ways, for example, with journaling or meditation. Getting ahead of menopausal symptoms. If you're reaching the age where you suspect the symptoms of menopause are around the corner, consider an anti aging panel to better understand your current health status and hormone changes. eNational Testing's anti aging panel, which is especially beneficial for women over the age of 40, offers insight into your heart and metabolic health, both of which can decline as you age. This panel makes it easier to identify potential issues before they become problematic. It looks at your cardiovascular health in addition to your kidney health, blood sugar, ovarian health, fertility, and sex drive. It tests your FSH and LH, testosterone, estradiol, and other important markers. This blood draw requires fasting, and test results are emailed to you in 3 to 6 business days. If you have questions afterward, you can follow up with one of our friendly clinicians. eNational Testing has more than 2,700 locations across the United States, and we even accept same day appointments. Find a testing center near you. Don't let symptoms associated with menopause stop you. Saying goodbye to your menstrual periods and hello to vaginal dryness, hot flashes, weight gain, night sweats, and mood swings can be overwhelming, but there are things you can do to improve the symptoms of menopause. Talk to your provider about your options and see if our anti aging panel is the right fit for you.